Hello, everyone, and welcome to the Team PUSD live stream teacher Q&A session. I'm Christine Peck. I'm the Chief Communications Officer for Poway Unified School District, and I'll kind of be your moderator MC today. I'd like to start off by introducing the panel that we have up here to answer your questions. To my left, I'll start with Carol Osborne, Associate Superintendent of Learning Support Services, Ron Little, Associate Superintendent of Business Support Services, Dr. Marion Kim Phelps, our Superintendent, James Jimenez, our Associate Superintendent of Personnel Support Services. We have Dr. Jennifer Burks. She is Associate Superintendent of Technology and Innovation. And we have Greg Mizell, Associate Superintendent of Student Support Services. And again, we are glad that you were able to tune in. And for those who can't tune in, we will be recording this meeting, and it will be posted on our website on our reopening page. And at this time, I'd like to turn it over to Dr. Phelps for a brief welcome.
Thank you, Christine. Good afternoon, everyone, and I'd like to welcome and thank all the teachers who are joining us here today on our Q&A live stream. We're hoping to be able to answer many of your questions that you have, but I want to first start off by thanking all of you for your hard work. I know many of you have been working really, really hard planning for multiple scenarios over this summer, and I've heard tons of really wonderful stories about how many of you have reached out to students and our families, and I'm very grateful for all of your commitment and dedication to the children here in Poway Unified. I want to start by saying that we apologize for all the different pivots and things that we've had to do in order to shift and make changes. But please know, like, our desire is not to try to make anybody's life miserable. The pandemic is unprecedented times. It's something that none of us ever could predict. It's something that none of us ever thought we would be sitting here having to do or to plan for. And you can imagine what an immaculate, huge task it is to try and redesign education on a dime. We're trying to be responsive to our 36,000 families and our thousands of employees, and understanding the risks, the fears, the questions, all of these things that we're trying to take in consideration. And please know that your safety, your well-being is our utmost concern. And so with that planning, it's required us to make some pivots and some turns. But please know and be reassured that the staff up here and many people that are not up on this dais have been working around the clock to try and get PPEs ordered for you, to put plans into place, to put formulas and schedules into place, and to really try to make this work for all of us. Many of you know that we've taken multiple surveys, and part of that survey is so that we can be responsive to what the needs are of our community. And I appreciate all the productive emails that we've received from all of you, so that it can help us to design the most viable and effective plan possible. I just want to take this moment to again thank all of you for your hard work, and let you know how much we appreciate your understanding, your commitment, and your support as we're all trying to navigate through these unprecedented waters together. So I believe now Ms. Peck's going to explain the process and the format, and then we have a ton of questions that you've submitted that we want to make sure we get to. And I believe that we have someone monitoring some questions if more want to come in that we can try and answer at the end. Thank you.
Thank you, Dr. Phelps. That's right. As Dr. Phelps mentioned, we did get submitted questions from teachers in advance, and so we'll try to answer as many of those as possible. Also, if you can see this link on your screen, you can submit additional questions during this live stream that someone will be monitoring this form. And so as those questions come in, we will try to get to those as well. And just for a reminder for our panelists up here answering questions, when you are speaking, please be sure to turn your microphone on. So let's begin. Our first category, so we divided our questions into categories. And to get through as many questions as possible, I'll just read them and we'll have you respond. So the first question is on mask compliance. What is the process for handling a student who refuses to wear a mask? Carol?
We will be asking parents to review expectations and best practices with their children prior to school starting. We will also incorporate the expectations on campus for students to ensure that they understand what the expectations are and the why behind wearing masks. If students do refuse, they will be sent home if they cannot be compliant. According to the California Department of Public Health guidelines, schools must exclude students from campus if they are not exempt from wearing a face covering. We also want everyone to know that if a student comes to school and they have forgotten to bring a mask, we do have masks that we will provide to students on campus. We will also work with the family if perhaps virtual learning may be a better option if their student is not able to be compliant.
Thank you, Carol. Next question is for Ron. Ventilation of my classroom. How can we be sure that the air in our rooms is safe to breathe?
Yes, thank you for that question. We've taken many steps over the past few months and will continue to do so to make sure that the air quality in the classrooms is safe. 5 steps I'm going to list quickly. 1, over the summer, we've completed servicing and maintenance checks to ensure proper operations of all of our HVAC units and our systems. Number 2, we are maximizing outdoor air exchanges in our existing HVAC systems, and the volume of air in the classroom that's being replaced with outside air is 3 to 4 times per hour, which exceeds recommended standards. We are extending our operating hours of our HVAC units, so we'll run them 2 additional hours before classes begin and 2 additional hours once school ends. We are also upgrading our HVAC filters to the highest MERV-rated filter. Now we're in the weeds. The highest MERV-rated filters that our systems will allow, which is a MERV 11, which will increase the filtering, obviously. And we're researching opportunities to upgrade even further to a MERV 13 filter where our systems will allow. And we think there are some that will allow us to do that. And finally, we're going to provide a standalone HEPA filter in each of our 1,800 plus classrooms.
Thank you, Ron. For middle school and high school teachers, this looks like a question for James. What if a student in my first period tests positive and the class has to self-quarantine for 14 days, what then happens to all my other classes? Will all my other classes now transition to online?
Thank you for the question. So per the guidelines, when we have a test positive case of a student, we are to notify the public health department and isolate the student and exclude them from school. And the guidelines also state that we would identify any close contacts, which is defined as a person who is less than 6 feet from a case positive for greater than 15 minutes. So we know in some school situations it may be difficult to determine whether individuals have met this criterion. However, with the physical distancing protocols and the design of classroom spaces with physical distancing in mind, which may include things such as one-way traffic flows through hallways, designing student workspaces to be arranged to maximize physical distancing, and following all the public health recommendations, we feel that it can be accomplished through the AM or PM or AB model at the middle schools and high schools, with fewer number of students in a classroom at any one time, that we are able to minimize close contact as it's defined under the guidelines.
So it wouldn't necessarily be all the classes. It would just be those in close contact.
We would look at those that were in close contact following the guidelines.
This looks like a question for Greg, more of a health screening. What is the process for COVID screening for staff and students entering a campus?
Thank you. So we've had an opportunity this summer to establish processes and protocols. We begin with signage. You'll have that uniform at all the school sites. We have transportation protocols. So for some of our kids, before they even enter the campus, they'll have already been screened. Our bus drivers are taking the temperatures of our kids, and they're also interviewing them. So before they even get on the bus. We're limiting points of entry at campuses so that every person coming onto a campus has to have both their temperature checked and answer there's an interview, a set of interview questions that each person will have to respond to, and assuming there's no temperature and the answers are appropriate, then they'll be free to enter the campus.
Okay, thank you. Ron, how can we disinfect shared materials?
Yes, thank you. Obviously, the first protocol will be to significantly limit the sharing of all materials. So to that end, students will be expected to bring individual learning materials from home. All hard surfaces will be disinfected at least daily. Hand sanitizer will be provided for each classroom, so obviously the extensive use of hand sanitizer will go a long way to help us prevent contamination. In addition, teachers will be provided disinfectant wipes and a UVC LED sterilizer wand to assist with disinfecting supplies and materials as necessary.
Can you, a wand that you literally wave over?
That's correct.
Got it. Another one for Ron. We have 5 to 8 minutes from the end of one period to the start of the next. What is the process for disinfecting my classroom between periods?
Yeah, this is a tough one given our manpower, our staffing levels, and the lack of time in between passing periods. So again, we're going to provide disinfectant wipes in every classroom. We're going to have the hand sanitizer in every classroom and the UVC LED wands, which we hope will be effective to disinfect during those passing times.
I guess piggybacking on that, Carol, is it a possibility that passing periods could be extended to take that into consideration?
We're working with our sites on looking at those minutes and also looking at how to create traffic streams so that we would have perhaps kids not passing as they typically do, kind of mixing close together, but perhaps having routes that would reduce the intermix.
Thank you. Another one for Ron. This goes to the cleaning and disinfecting protocols for classrooms and bathrooms throughout the day and at the end of the day.
Yes, thank you. This one, actually, I'm going to ask our Director of Facilities and Maintenance, Mr. Chad Coster, to review with us, as he's been doing extensive work in this area.
So the work that is going to go on, every classroom, as Ron mentioned, will be disinfected every day, at least once a day. We're going this way. Thanks. Sorry about that. So we will disinfect classrooms every day at the end of the day as we go through it. They'll do their normal route as they go through. We're going to be able to, every other day, do the deep cleaning in every classroom. It's similar protocols as they are now with vacuuming and wiping and where they're at. Every classroom will be gone through with any kind of soiled areas, any kind of visible dirt. All that will be cleaned before we disinfect. And then we'll go through that. So we're working some staffing models, and we're trying to see where we go from there to increase that even more in the classrooms. But they will be every single day when you come in at the beginning of the morning, cleaned and disinfected. In the restrooms, again, the big deep clean top to bottom will happen at night. Everything will be disinfected. Throughout the day, they will be spot cleaned and they will be checked to make sure that they're serviced with paper towels and soap and all the supplies are available, as well as a disinfecting sweep through with all of the touch points. So, toilet handles and sinks and doorknobs and all those will be disinfected throughout the day as well. So.
And if I could just add, just to reiterate a point that Mr. Coster made, we will be supplementing our custodial support. So we will be hiring additional custodial staff to make sure that we can achieve all those tasks that Chad just mentioned.
Thank you, Chad. Thank you, Ron. And just a reminder, if you're watching this streaming live and you have additional questions that come up, if you look at the tiny URL on your screen, you can submit additional questions during this live stream at this tiny URL, which is https://tinyurl.com/PUSDTQ. That's PUSDTQ. And so we'll be monitoring those questions and trying to get to them at the end of this session. Okay, we're going to switch gears now to special education. We've received many other questions about special education, and most of them have been forwarded to the special education department, but I think since we have Greg here now, we can have you address some of the top questions.
Sure.
The first one is, will SPED be getting extra support for either push in or pull out models? Numbers are high, and resource teachers at sites won't be able to meet all the needs in the shortened day models.
So we're gonna look at this case by case, and I think at this juncture it's hard to say because we don't have the hard data. But where and when there are those situations where there are conflicts between the VLA option and the on-campus option, where and when our staff are stretched too thin, we have a team of program specialists and fantastic directors who are ready to step in and add support where and as required. Caseloads will remain the same this next school year as traditionally they've been set at. So we're not anticipating a shift there. If there is a spike in students qualifying for services, again, I just want to reiterate, there will be support.
Thank you. And for SPED, if we go virtual, how are we going to do testing since it's required to be in person? Would students then be able to come in for testing at arranged times?
It's a great question. We are right now actively exploring whether or not we can conduct assessments. We're working with our school psychologists, and again, directors are on that. Our understanding is in a virtual space, in the present with us on the county monitoring list, we're not allowed to provide instruction. The question is, are assessments instruction? Our belief is assessments are not. But before we can recommence assessments, we have to get the green light from the San Diego County Health and Human Services Agency. So we're actively pursuing that presently. Can't really predict what the outcome of that conversation will be. We're also looking at digital assessments. So we agree IEPs will recommence September 2nd, and assessments are a critical component of that work. So we're actively working to mitigate the challenge there.
Okay. Another question for you, Greg. Will SPED be held to minutes on students' IEPs? Some parents said that their children were not receiving their minutes on Zoom.
So March to June, we were in a distance learning phase. We were kind of in an emergency space, and so minutes were probably not being met. We're now we're moving in the VLA to a place where there's going to be more rigor, where the instructional program is more robust. And so, yes, the minutes are running and will count. We need to adhere to the requirements of the IEP, the same as we would traditionally.
Thank you. Okay, we're going to transition to workload and our staggered schedules. Since all teachers will have students with them for 4 or 5 full days of instruction, what is the expectation for assignments for students who are not on campus at that time? Carol, I think that's for you.
Thank you. So as we think about the staggered schedules, what we're thinking is it's not teaching online as well, but thinking about how might teachers collaborate with their colleagues to plan for, say, flipped learning. So if you are working on a unit and rather than reading text in class, you would have kids do some of that reading at home in preparation for the in-class discussion, so that we really think about how do we prioritize our time that is face-to-face with students, and what part of the learning and preparation for learning or application of learning can be done outside the classroom. So typically we have more blocks of time in class and kids are working independently or reading independently. So those are the things that could be flipped so that kids could do those things in preparation or in review of the learning or applying what they've been learning in class during that independent time that they would be at home. We also have personalized and adaptive curriculum for ELA and mathematics for K-8 through additional programs that we've purchased that would support students being able to do high quality learning during that time when they are not in the classroom. As we think about teachers coming together and planning, that is an essential aspect of being prepared. So having teacher teams come together and focus on what's the essential learning versus covering the entire textbook. Our teachers are the experts and can come together and think about how do we adjust our learning, but how do we make sure that essential learnings are covered. And so planning for what is most important to do when kids are with us face to face, and what aspects of learning can be done in preparation for or preview lessons that are coming up, and so on. So that will be the expectation, not that they are also planning for online.
Thank you. Another one for you, Carol. How many minutes of live instruction are required daily at each level in the VLA and while we're engaged in virtual teaching?
So the virtual schedules that have been posted online are a strong foundation for making clear what the expected instructional minutes are for grade level teams. So I highly recommend that you take a look at those. We worked with teachers to create those, and we worked with PFT to make sure that they were in alignment with the required minutes and the expectations for teacher hours. So those should be the foundation for making adaptations, and those clearly articulate the expectation. Daily contact multiple times during the day, those are the expectations that we have for students' instruction, very different than when we had distance learning.
Okay, thank you. This is one, looks like for Jennifer, with technology and innovation. Will teachers who have tech access problems or simply prefer to work from their classrooms be able to work from campus classrooms while we are all virtual?
Thank you. Yeah, the answer is yes. For teachers who have tech access problems or simply prefer to work from their classrooms while we are virtual are absolutely able to do so.
Okay, thank you. Back to Carol. Are elementary teachers going to be asked to do core testing?
So we are currently reviewing and looking at the alignment between our core assessments and Lexia assessments for K1, as well as iReady assessments, because there's a strong reading diagnostic that comes with iReady. So we are looking at the alignment that we might be able to use those online assessments in both on campus and virtual in lieu of core. We want to just make sure that we still have our universal screening at first grade, and so we are reviewing those assessments to make sure, but we feel that we may be able to use iReady and Lexia in lieu of core.
Okay. Well, you're popular, so I've got another one for you. How many different courses might I be required to teach? Normally, teachers would have 2 preps in either a quarter system or tri-system. Is it potentially 4 trimester system, 4 different classes in a trimester, and 3 different classes in a quarter system?
Okay, so the simple answer to that is we believe it'll be similar to what you are normally assigned, so that the 2 preps. And just as there are discussions in other times where the master schedule presents a unique opportunity, principals or administrators, counselors, that there would be a conversation with you if there is a need beyond 2 preps, so that you would be consulted with if there was a need beyond the 2 preps.
Okay, thank you. Also, Carol, is it possible for teachers to have access to Annuity or another prescribed curriculum for classes that have it? I know it is used in summer school. The schedule as outlined is going to be way more than 7-hour workday, especially for those who have multiple preps.
So yes, we are 2 things. We are looking to expand Annuity licenses, the concurrent licenses that we have. We're looking at doubling those. We are also looking to ensure that our high school teachers who are working in the Virtual Learning Academy have access to the POWI virtual courses. Those courses have been developed by teachers and with teachers, and we are also looking at expanding some of the course development to ensure that we have POWI virtual courses across all areas. I think English is an area that we need to develop, and we are bringing teachers in to create that now. So yes, Annuity and POWI virtual courses will be available to access.
Okay. We're going to transition to another category, and this has to do with family or teacher personal life. The first question is, assuming a staggered start for those of us with our own children in the district, how will we mitigate the different in-person schedules? Will ESS be available?
So the answer is yes, ESS will be available. And so if we are, one of the considerations for determining AM and PM, we are hoping that all of our ESS students will be able to be placed in the AM block, so that they then would be able to access ESS from 11 a.m. to 6 p.m. And currently, teachers already receive a reduced rate for ESS, and that will continue to be honored.
Okay. I think you answered the second question, which was, will ESS be available for the later part of the day? I think this next question would be a James question. How are sick days covered if we get COVID-19? Are sick days the same in general for this year? For example, my child or I have a fever for a day. How long would I have to stay home before returning to work? And do we still only have 10 sick days? There's a lot of questions.
Yes. So several questions in this one. So let's break them apart. If there were a staff person who fell ill with COVID-19, they would be eligible to receive leave under what's called the Families First Corona Response Act, and that would entitle an employee for up to 2 weeks of paid sick leave at the employee's regular rate of pay, up to a limit of $511 a day. If that employee were unable to work due to a state or government quarantine, or perhaps under the advice of a healthcare provider, and or if they're experiencing COVID-19 symptoms and are seeking a medical diagnosis. Those would all be qualifying criteria for this recently implemented FCRA leave, as we call it, that was introduced by the federal government earlier this year. For those that might have symptoms, according to the CDC guidelines, a runny nose or a fever can be symptoms potentially of COVID-19. We cannot require that a sick staff person be tested. However, if they are experiencing those symptoms following the guidelines, they should stay home and follow the CDC guidelines for isolation, and may return to school after 10 days without symptoms and 3 days without fever. However, we continue to monitor the updates on these guidelines from the CDC as well as the California Department of Public Health, because many districts like ourselves have been asking for clarity on the interpretation of this recommendation if somebody is symptomatic.
Okay, another question for you, James. Will the district be giving any thought to keeping teachers and their children the same placement that they apply for? For example, I'll most likely be applying for myself and my son to be in VLA. Logistically, it's the only thing that makes sense for our family.
So according to the teacher commitment survey, there is not a box to check or a method to indicate this unique preference if there is a staff member who's requesting virtual learning, and they may also personally have a child in our district that they are requesting a virtual learning format. However, based on staffing need, we will work with those teachers as best as possible to place them in their selected preferred choice that they've indicated on the survey, based on the numbers needed for staffing and the number of students selecting virtual learning. If in those few cases they were not selected, the teacher would either have to make arrangements at home for their own personal child to continue in virtual learning, or perhaps request at their child's school to then switch and assign their own personal child for in-person instruction. So overall, we would do our best to place teachers in the assignments and preferences that they've indicated in their surveys.
Okay. These are some additional questions. Is there any way for teachers to have a first choice, second choice option when making the commitment? My question is, what if I don't get it? Do I then get a second choice, or am I just assigned somewhere? Carol?
So we have close to half of our teachers have already made their selection. We did consider this when we created the survey. However, we will continue to work with our teachers. So if a teacher selects, for example, the Poway Home Education Program, we anticipate we may have more teachers than we need selecting that option. So we will need to consult with them about what is their alternate option if they are not selected for the Poway Home Education Program. The same will be true for New Direction. So we will need to continue to have conversations. It's not you didn't get that, so now we'll place you anywhere we want. It'll be follow-up with the site administrators as they're creating their master schedules.
Okay. Going to Jennifer, if we're going to do virtual instructions, our workstations need webcams and microphones.
Thank you. To support with virtual instruction, laptops with access to a webcam and a microphone will be available for checkout, so that we will have those available to support teachers during virtual learning.
Okay, another one for you. Will teachers be able to continue to use Seesaw as their primary delivery for communication and assignments, or are we going to all be forced to use Canvas, which isn't kid-friendly for the littles?
Thank you. As you know, Canvas is our district learning management system that all teachers will be utilizing with their students. Other instructional tools, such as Seesaw, can be incorporated to support student learning and engagement, but we all will be on that continuous and systematic platform.
The meaning, like Canvas would be the home page, and then from there,
Correct.
different apps.
Correct. So Canvas, as our district learning management system, enables students to be automatically enrolled. Parents have access to be able to see what's going on. There's that communication between students, teachers, and parents. And Seesaw is a great engagement and additional instructional tool to be used alongside of Canvas.
You stated that if we open on September 2nd, we will open with a staggered schedule. If we open on September 3rd or 12th or in October, will we open with a staggered schedule as well? So I think that means when we get the approval to physically reopen, whether that's by September 2nd or later in the fall.
It's going to be dependent on what the reopening is. It's a very difficult answer to respond to, or question to respond to, because we don't know if the governor says, okay, all schools are open, but these guidelines have to be in place. And so if they say that we need to continue the 6-foot distancing and all of those things, then we have to continue to push forward with our models that we've developed, which is the hybrid model, the AB or the AM/PM model, and the kids who selected online all virtual have to remain on that. So it just depends. But our goal is to keep it as stable and consistent for kids, at least until the first grading period is over.
Thank you, Dr. Phelps. For VLA, and this is for James, when a VLA teacher is sick, do we get a sub, or are we able to do pre-recorded lessons?
We intend to, we're right now increasing our recruitment for substitute teachers, both those that would be available for in-person instruction, as well potentially substitute teachers who could be available for virtual learning. We will still working through this process at a site level, but if we do have a virtual learning teacher who's out and needs a substitute, there's some flexibility in terms of the plans that can be provided either for a substitute or pre-recorded lessons. This would depend upon the amount of time that a teacher may be out ill. If they unfortunately were out for 2 weeks because of a COVID-19, we would need an actual substitute to fill that role. If it's for 1 day only, I think there's some flexibility on how we provide instruction, whether that's through pre-recorded lessons, but I think that's an area that is for further problem solving at the site level on how we can accomplish that for those short-term absences.
Piggybacking on that, being that many of our subs have been older retired teachers who likely will not want to risk coming to school to physically sub, could the district then reach out to them and get a pool of VLA only subs who could do online? James or Carol, one of you?
I can take it if you'd like, James. It's what we know is personnel is creating a survey of our subs to see what people are willing to continue to sub on campus, and then we'll be able to identify from that survey subs that are willing to sub both on campus and virtual only, so that should help us with this decision.
Thank you. Back to James. How are involuntary transfers going to be handled? Is there a timeline? If I apply for VLA but don't get it, am I more likely to be transferred to another site? Will I be able to bump a teacher in my credential area with fewer years in the district at my site if I get told that I must go to a different site but don't want to?
So overall, let's just want to reassure folks that the district and PFT have a true desire for teachers to be placed in their preferred placement, whether that be on campus instruction or virtual teaching. In the cases of an involuntary transfer of staff to another school site, which is not our desired option, however, in this era of with the pandemic, there is a need for flexibility in scheduling and staffing, and that will be essential. The selection for involuntary transfer will follow what has been historically the least district seniority amongst teachers at a school site within their content area or their credential area. Any teacher who is involuntary transferred as a result of staffing needs due to this impact of the COVID-19 or due to virtual learning assignments will have the right of return to their home school site in the following school year of 2021-2022.
Another question for you, James. When will we know our assignments? Many are extremely stressed out about this. Some teachers who want VLA have said their interview isn't until August 17th. Why is the process going to take so long?
Good question. Once the survey response window closes for both staff and parents, depending on the school site programs at the high school level, the middle school, or elementary level, the work involved in adjusting the master's schedule and placing students within one of these two models is extensive. It will take a little bit of time for administrators at the school sites to problem solve and redesign their master's schedules based on these numbers. And we know with certainty our principals certainly understand the stress involved in the wait for our teachers. But each school site, in order to accomplish a site-based learning model, will need that time to finalize their schedules and inform teachers. Our goal is to finalize those master schedules and then inform those teachers as quickly as possible based on the number of virtual learning assignments that are requested from our teachers and the required credentials for each one of them. After having first made every effort to support staff who may be at higher risk for severe illness or those who cannot safely distance from household contacts, we would then place any other teachers who requested a virtual learning assignment. As part of that process, based on the actual numbers that are needed, it may be possible that a principal may schedule a consultation session with a teacher in the last group to inquire about their experience, for example, their current pedagogy in virtual classroom environments, their strong Canvas background or grade level or content area background to make any final selections. If we have more requests for virtual learning, then we have positions needed for the student numbers.
Another one for you, James. If I choose Poway Homeschool, do I have to submit a transfer, and can I go back to my homeschool the following year?
Question. So in this environment, a transfer request, as we have done in the past, will not be necessary. The information that's submitted by teachers in the commitment survey will be the means and information by which school sites will know the assignment request of our teachers. If a teacher chooses the virtual learning assignment and is transferred to another school site, or let's say the homeschool program, those teachers again would have rights to return in the following year to their homeschool site.
If I am chosen for the homeschooling program, what happens after the 2020-21 school year if there's not a large influx of families desiring homeschooling for that year? Where will the excess teachers be placed at that time? Will they be randomly back into school sites with available positions?
So as I mentioned earlier, our goal would be those teachers who were involuntary transferred would have rights of return to their home school site in the following school year, 2021-22. If that return to the home school site were to cause an overstaffed situation, we would follow what is our process currently, which is at that point in time, volunteers would be sought to be involuntary transferred at that site. And if no volunteers came forward, then the teacher at that site with the least district seniority would be involuntarily transferred in the 2021-2022 school year.
Okay. On the commitment form, what do I mark for the work site for the fall, as the homeschool program is not an option? Carol?
So the homeschool program and New Directions are both options on the teacher commitment survey.
I think the question is it asks you what your site is before you are asked what your selection is, and they're saying that they're currently a homeschool teacher, but that's not an option as the site, I think. So then I think they could mark new directions in that
Yes,
case.
I think they can do that. Yeah, mark that because I know we currently have had 2 teachers part-time in our homeschool program and a small number of teachers in our new directions. So they will remain and we'll be adding to that. So I think if they select the new directions, that's fine.
Okay. At this time, that wraps up some of our pre-submitted questions. Do we want to take a quick break, or do I want to turn it over to you?
Yeah.
Okay, I'm turning it over to Dr. Phelps. She's giving me hand signals.
So we received approximately 200 questions online, and we'll try to answer as many of them as we can. I believe I have the first 60, and we're still waiting for the rest of them to print out so we can see them all. So I'll go ahead and start, and then I'll alternate when needed as we preview, depending if I'm having to answer some. So one of the first questions says, do I have to wear a mask? Yes, if you're a staff member, you have to wear a mask. Another question, will students bring their Chromebooks, backpack, and lunch to and from school? Yes, we're asking all students to bring their own equipment and supplies to and from school. However, if a student is purchasing lunch or getting free or reduced lunch, will receive a grab-and-go lunch on campus. Next question, and please, any of you, if I'm incorrect or you have anything to add, feel free to jump in. Next question, what would be the course of action if I select VLA for my own child, 2nd grade, and I'm denied VLA as a teacher? The best response I can give to that, it's kind of no different than pre-COVID, right? So we have to make accommodations for our own child, whether it be daycare, childcare, or getting them to school, in addition to juggling our own responsibilities with our jobs. Anyone want to add anything more? Okay, so the next question, VLA does not show AVID on the FAQ pages. Will AVID be offered? Yes, AVID will be offered. Next question. If your credential allows, can a teacher who selects VLA end up anywhere, or will former teacher roles be considered? I think we kind of already answered that. We're going to try and accommodate as many people as possible. Whatever your selection is, we will try to do our very best to accommodate your requests. Our priorities will look at those that have received doctor's notes that say that they're in the high risk category, and then we'll work from there. But realistically, our role as a school district is that once we're given the authority to reopen our schools, we have a job to do to fill those positions. Respectfully, I shared this scenario earlier, and I asked this question, and I know the majority of our teachers are selecting to come back, but there have been many who have expressed that they do have a fear to come back. And one of the things that I had shared earlier is that Costco had no choice but to stay open. And if they had employees who couldn't work, what did they do? Because they still had to fill those positions and people still had to work. If their employees had a fear, and the fear wasn't because they had any kind of medical condition, what did they have to do? Because they still had to open. If the doctors and nurses had a fear of what's going on and decided that they were too fearful to come to work, and they all decided to do that, would we close down all our hospitals, and would all our people get their care? And unfortunately, as educators, we all took an oath, and we never could have predicted a pandemic. I completely understand and am sensitive to everyone's needs. If anyone has high risk underlying conditions, I would be one that would definitely qualify. But as a person and as an educator who took an oath to serve students and as a public servant, if we're called to open schools for the sake of our community and our children, I need to show up to work. So although we will work really hard to try and accommodate the needs of all of our requests of our teachers, we still have a job to do, and we still have positions that we need to fill. So knowing that and keeping that in mind, hopefully that'll address some of these questions. So if you select VLA, could you end up anywhere? I think that goes with almost everything. We're going to try and place teachers in their selection of their assignments within their schools, within their appropriate credentials and their appropriate grade levels. However, if we have a situation where we don't have enough, let's say an art teacher who's teaching virtually and we only have 10 kids from Poway High, then would it be possible that they could be joined with 15 more kids virtually from RB High School? Yes, that's a possibility. There are various scenarios that we have to look at because obviously we don't have millions of dollars to spend on buying enough teachers per classroom, and obviously you can imagine that that would not be fiscally possible. Are there any confirmed COVID cases in the district, staff, or students? Yes, we had one student that was a confirmed COVID case, and we had one employee that was a confirmed COVID case, but that person contracted it after their work year concluded and when they traveled out of state on personal reasons. If a teacher has a commitment, are they allowed a sub? Yes, they're still allowed a sub, right, James? I know we are trying to keep cohorts together, but subs will probably be needed at some point. So we will try to hire as many subs as we possibly can, and everyone has a right to secure a sub. Has or will PUST be requesting a waiver for elementary schools to start on campus? Right now, we haven't applied for any kind of waiver. The reality is we don't even know what the guidelines are on the waiver or what the waiver is requesting. So we're waiting for the state to provide the county guidelines and direction as to what the waiver is, and then we'll look at that and take considerations and seek input from the constituents that they're requiring us to do so. But either way, if the district applies for a waiver or not, the waiver still requires, I believe, the county health department to still approve it, and it would only be approved if our particular area shows that we fall far below the number of cases is what I would assume. But there are a number of factors that would have to be considered before a waiver is even approved. As a teacher, I want my children to go to VLA. However, we've already answered that one. When, by what date will we know our assignments? Carol?
That is a good question, and my answer is it depends. It depends on when our sites are able to sort through the data and start building those master schedules, because as you know, master schedules are complex in a normal time. They start building those in May and are resolving conflicts all the way through June. So now we're asking our sites, especially our middle and high schools, that they are building 2 master schedules. So we need you to continue to be patient, and we will be working with you through this process. Elementaries may know your assignments sooner because it's a smaller scale. But our secondary sites, it may be 2 to 3 weeks because we need to sort through what students are on campus, what courses are they taking, what teachers and which credentials are available to teach on campus, and all of those multiple factors as we create those master schedules. So short answer, it may be 2 to 3 weeks.
Thank you. And we're working really hard. And so I think there was a question in here. Someone said, why are you asking us to give our commitment forms the same times the families are? Because the sooner that we can figure out where and how many students that we need to place and in what courses, we then need to start plugging in the puzzle pieces to figure out, to ensure that we want to try to accommodate all of our teachers in their appropriate credentialed spaces and their requests and comfort areas, as well as wherever they taught before. So considering all of those multiple factors, we're trying to honor all of your requests, which is why the sooner we know, the better it is for all of us and your principals to help us to file that. But we are trying as soon as possible to let you know. The next question is, if disinfecting wipes are not available, how can we tell families and staff that rooms will be disinfected? Teachers should not have to pay for these. We don't expect teachers to have to pay for them. We do have disinfectant wipes. We do have large quantities of disinfectant available. We did purchase that. We were one of the first districts to put in large orders. Ron, do you want to add to that?
I would just add that we're also being supplemented considerably by the San Diego County Office of Ed with respect to sanitizer and disinfectant and wipes. So there will be plenty to go around, and as we said earlier, every room will have its share of disinfectant wipes.
Thank you. Next question. While participating in physical education, how can we be assured it is safe for students to work out with masks on?
So I've seen the Padres out warming up and practicing, and they're wearing their masks, and some are not, and they're physically distanced. So it will be, PE will need to be organized in a way that we are wearing our masks if we are not physically distanced, and if we are able to utilize a large field and have physical distancing and we are outside, there may be opportunities for a mask break. However, PE teachers will need to work on that and collaborate with their colleagues to determine how that will look. Health and safety is our first priority.
Thank you. The next two questions we already asked. The next one. When will we know the new school calendar? As you can imagine, the new school calendar, the calendar is quite complex. It's not as easy as one person looking at it and changing it. It also has to be vetted through our multiple labor union groups. But Carol, do you have anything more to add to that?
No, and I know in the parent forum there's questions about the grading period and so on, and so we have a draft of the new school calendar. As soon as we have it available, we'll be posting it, including the new grading periods, and graduation, I believe I can safely say, will be June 18th, and let's hope it is on the stadium as we want them to be.
Is there a criteria based on the number of active cases in our area to determine when we transition from hybrid model to fully back full time? No, the criteria is strictly based on the CDPH and the governor's orders to determine when all public schools can reopen, and I believe that's based on when a vaccine is available. Why were student and teacher commitment surveys sent out at the same time? I answered that already. Do you have any, Jennifer? Okay, I'll ask the next one. Now that the Virtual Learning Academy is site-based, what does this look like for elementary RSP teachers? Will we be responsible for providing?
I think I saw the rest of that question. So it's very possible that our RSP teachers will have a blended caseload, students on campus and students virtually. Remember, those caseloads remain the same, and now that we're going to a site-based model, case managers will be responsible for that same number of students that you would typically. It's going to be a little more complicated, providing support and being responsible for an IEP for both groups. I get that. But as in real time, as we kind of move forward in this phase, there will be support, both program specialists and directors. So we recognize this is a whole new thing, and we're going to learn together. So, but to answer the question, yes, you very well could have students in both spaces, and you might be responsible for an IEP where you're not the primary person delivering instruction. I mean, that's not an ideal situation, but it's possible. So.
Okay, the next two questions we asked already. The next one is, will teachers in their 60s be considered for VLA since they are a high-risk category, even though they may not have underlying health conditions? I think it's matter of preference because we have some employees who are over 60 that are requesting to still return on campus. So it's going to be a matter of request and then placing them in priority. For the homeschool program, it is unclear whether teachers are creating activities and assignments for students or if they are just providing parents with a curriculum outline for them to use and make decisions in their teaching.
So, Patty Hurd has developed, we have roles and responsibilities for both Poway Home Education Program and New Directions, and we can email those to you if you have that specific question, but you will be meeting with parents and providing weekly check-ins. The parent is the primary teacher for the homeschool program. You will be providing them the curriculum. The curriculum is the same that we use in our classrooms, but the parent is the person that is providing the primary instruction and assignments. And if you would like the job description or the roles and responsibilities, please email Patty Hurt or myself and we can provide that to you.
The next question, in the AM/PM model, how is it feasible to clean every classroom to use after the morning group? Ron?
As I mentioned before, at the elementary level, we're anticipating an 1.5 to 2 hour break between sessions, and with the additional custodial support that each school will be given, that should be enough manpower to clean every classroom and the restrooms.
In addition to, we're purchasing the UVC LED sterilizing wands for every single teacher, so they'll also all have that at their availability, and there will be disinfectant wipes in the classroom. We're also asking families to obviously supply their own children with, hand sanitizer and wipes and things in their own backpacks so that they can sanitize as much as they feel personally necessary. Next question, has the inequity of gas and commuting expenses been addressed? Those who are online will spend significantly less on gas, while those who are in person will spend more. Those who are in person should have their commuting expenses compensated. Bottom line, salaries are not equitable between those who have to commute and those who are allowed to teach in the VLA model. Again, this goes back to my response earlier that just like if you were to have to go to work, you wouldn't have been compensated for gas. And in a perfect world, if we would love to do that, but obviously our budget doesn't allow us to do that. And whether people choose VLA or gas, that's a personal, VLA or teaching on campus, that's just a requirement of all of us having to go to work and get a paycheck. So next question. In-person teachers will likely use more sick days than usual because we will be expected to stay home with any symptoms unrelated to COVID. What mitigation is the district providing for this case? It seems unfair that I am having to use many of my sick days for this when it will not apply to virtual teachers. James?
Our goal is with the safety measures that we're putting in place and asking that teachers maintain at least 6 feet or more physical distance from students in the classrooms, that we can minimize the illnesses amongst our teachers who are reporting to the building to provide in-class instruction. If there are, as we mentioned earlier, in cases where somebody is COVID-19 or seeking a medical diagnosis or support from a physician, there is additional leave available under the Families First Coronavirus Response Act. As well, we have not, the question is, what mitigation is the district providing for this case? We're really trying to implement the best preventative measures and safety precautions in the classroom to minimize the number of absences or illnesses that might occur. However, if there is someone that does fall ill with COVID-19, as I mentioned earlier, there is additional leave under Families First Corona Response Act for that very purpose.
The next question would be, I received an email update from ESS. It states that ESS will only be open from 11:30 to 6. Can you tell me how teachers will be able to utilize ESS for their own children and attend work? Is this something that we would like the director of ESS to answer? Would you be able to come up and answer that question?
While she's doing that and getting prepared to answer that question, can you answer this one, James? If I have to quarantine for 14 days because a child in my AM class has tested positive, what happens to my PM class?
If we have a teacher who's under quarantine for 14 days, again, what we would do if we have a child in the AM class that's tested positive, we would follow the criteria under the definition of close contact. That those that have been in contact less than 6 feet of distance for more than 15 minutes. Again, the preventative measure is to ask all teachers to do their best to maintain at least 6 feet or more from students so they do not come into close contact. However, if that were to occur and the teacher was quarantined for 14 days, we would have to obviously provide a substitute for both the AM and the PM class. The PM class Likely those students would not have come in close contact by definition with a child in the AM class, so that cohort would continue to attend class in the afternoons each day.
Sorry. It stated that ESS will be open from 11:30 to 6. How will teachers be able to utilize ESS for their own children to attend work? For example, I teach high school, and my school, it just got cut off. The rest of the question's cut off. It says my school, I teach high school, and my school starts at 7:30 in the morning.
Sorry, but we cannot guarantee that we can provide services for all the different scenarios. I just want to share that we were limited in what we could provide by the regulations we are able to operate under. Title 22 does not allow us to provide continuous service from 6 a.m. to 6 p.m. even if we wanted to and could with staffing. We're just not allowed to do that. A before and after school program has to have a gap in their services, and we chose to do the afternoon session because we knew that we had the greatest chance of being able to staff that possibility and provide service to as many teachers as we possibly could.
Thank you. The next question will probably be for Carol. Could sites adopt an AB or AM/PM on-campus model if they see it as what is best for their families?
So we've already adopted the models. So our elementary school will have the AM/PM model, and as well as our middle schools, and our high school will have the AB model. The next question is, what is the minimum amount of time between being virtual and going back to classes, assuming that we start the school year virtually? We can't answer that. So the best answer that I can give to that would be that if we have to, assuming that we are unable to open schools and we have to open the schools all virtually, and once the governor gives the order that all public schools are open or reopen, we'll have to assess where we're at and ensure that our staff and our schools are ready to make that transition and determine what that transition looks like. So, anything else? No?
The next question would be, can TK teachers require their students to wear masks? James or Carol?
So our guidebook currently is following the most recent updates of the California Department of Public Health guidelines, which indicate that students in grades 3 through 12 will wear masks while in the school environment, and students in TK through 2 will be highly encouraged, and that includes us doing our best effort to educate, teach, and model to those students on how to become accustomed to wearing those masks if they are physically able to do so. So our goal is to accomplish that, but at this point in time, the requirements under the CDPH provide that students within those grade levels at TK through 2 are not required, but shall be encouraged.
Thank you. The next question will probably be for Ron or Chad. What type of spray cleaning will be used? Should I be concerned with decorative bulletin boards and other items in my classroom?
No, all of the products that we'll be using, we're using a few. They're all EPA approved for COVID and in compliance with the Healthy Schools Act. So no reason for concern.
Thank you.
The next question is, what happens when our HVAC system stops working? We have to wait for maintenance to come out the next day. This happens every year. Chad, do you want to answer that one? Can you guys just hold on to a mic so that you always have one?
So again, working to be super, super responsive. We will have to keep the air moving. A lot of times we may lose cooling capability, but we'll be able to continue to circulate the air. They'll be case by case. We do have our guys on standby, and we are testing them out constantly. If we need to move to another building or another classroom, we'll be able to adjust on the campus as possible, because we will have reduced student loading on the campuses.
Thank you. It was mentioned that we should limit sharing materials, and students should come with their own materials. What about low-income families and students who do not show up with their own materials? Will PUSD provide sets of supplies and materials for students who do not have any? Yes, our district will work towards providing those materials for those students that are in need. Can you clarify if each teacher is getting a UV wand? Yes, every single teacher in the district that is on campus will receive a UVC LED sterilizing wand. I would assume you don't need one at home, right? Is every classroom getting a hand sanitizer station? There will be hand sanitizers in every classroom, and there will be hand sanitizer stations strategically located throughout each campus. Follow-up question for Ron regarding standalone HEPA filters in all classrooms. Are these HEPA 3 filters?
Short answer is I'm not sure. I know they're HEPA filters. I have one in my office. I'm actually trying it out as we speak. I'll have to research the HEPA 3 piece.
Did you have one?
Do you know, Mr. Coster, off the top of your head?
I'm doing Google search right now. I do not know.
Okay.
Very good.
But
We'll get the answer
Real-time
to that.
research. Thank you.
Will the district provide teachers with N95 or N99 masks? James?
Short answer is no, we will not be providing N95 masks for teachers. We have provided and have them ready a cloth 2-ply reusable face mask for every one of our teachers and every one of our employees in the district. The N95s are challenging right now in the supply chain to receive. We have set aside the number that we do have for those working with students who might be quarantined, such as nurses or health technicians who might be directly working with a child who is symptomatic and needed to be quarantined in another room.
Will teachers receive sneeze shields and guards for their desks? We're purchasing face shields and face masks for every single teacher, and we're purchasing masks for all of our students. We are not putting up shield guards for their desks, but I don't really know any teachers that sit at their desks the whole time they're teaching. So we are not doing that, but we are putting up those shield guards at places where customer service is provided, so at the front office and at certain windows. Why are middle schools being forced into the AM/PM model when it is clearly aimed at elementary schools who have small cohorts of students that they see on a daily basis? Middle school teachers will have a much greater daily exposure rate. The AB model was much more conducive to the middle school environment, as was supported by our middle school principals. So there was a lot of debate on this, and some of the contributing factors, and Carol, please help add in. But some of the contributing factors that was discussed was that the teachers and the students the teachers and the families who selected the on-campus model are selecting to be on campus, and they weren't selecting to be on campus 2 days and then the other 3 days virtually. And that was feedback that we received from families, in addition to from teachers, saying that I chose to choose to teach on campus, and I didn't choose to teach virtually and on campus. So that was one of the reasons. The other main important reason is that what we do know is the number one important reason is that we know that children need to see and have face-to-face instruction every day with their teacher is the best case scenario. And so even though the AB model is best logistically, and it's easier to coordinate and organize a master schedule, it is not what's best for students or our families and or for our teachers who selected to want to teach on campus. Do you have anything else?
I think you covered it, Marian. I think that, when we think about our strengths and interacting with students, and we think about our middle school students and having that contact each day with teachers and having a cohort that they are coming on campus with. That's also a way for us to support continuity, address social emotional needs of students so that they are with a teacher face to face and getting that daily support and contact and leveraging the strengths of our teachers who are able to do what they do best, and that is teaching face to face.
The AB model is much easier for our high schools because we visualize that our high school students already naturally transition on and off campus through off schedule courses. Because they're so large, there may be circumstances where even a given student who may be on an A track or a B track can also apply and take an online course and still be an on-campus student. So there's a lot more flexibility with the high schools, and we needed to lower the footprint for our high schools as much as possible, because currently our survey is indicating that we have upwardly between over 70% of our families who want their children to come back on campus. If we begin virtually due to numbers, will teachers have time to prepare to switch to in-person when numbers allow? Or when we are off the list, will we go to in-person the next day? How will that transition work? So once we get off the list, no, we will not go to in-person the next day. As you have seen, there's always complicated situations. It depends on when it is, what time of the year, if there's any further guidelines or restrictions that the health department or the governor puts upon school districts. All of that will have to be considered. But we will do our best to ensure that staff and families are ready for that transition when we need to do that.
I can ask the next question. Does the requirement, this is for you, Greg, does the requirement to send kids home due to non-compliance wearing a mask apply to students with special needs?
So if it's a manifestation of a disability, no. In that situation, it's a behavior intervention plan that's going to need to be put in place. You can't exclude students for a disability, even when it comes to something like wearing a mask. If it's not a manifestation of a disability, then the same rules would apply to a student with a disability as any other child.
Can you elaborate on these wands? How do they work, and are they efficient? Yes, they're efficient. They're used by doctors and businesses alike. They are very simple to use. I use one at home. You open it up. They're about $100 a piece. They open it up. You scan over the items that you want to sanitize, and they're sanitized within minutes. And it's the same thing like disinfectant wipes. It says it's 99.9% killing all germs and bacteria. Yeah, one.
I do. Carol, this is for you. Can a teacher choose to teach both VLA and person at the same time?
At the same time might need some clarification, but teachers can choose to teach both a VLA period and an on-campus period. So you can, and we actually, looking at the survey, we have many teachers offering that flexibility, which is great. I know several of our high school folks have said, I'm happy to teach a couple sections on campus and in one section virtually. So that type of flexibility is very helpful. So the answer to that is yes.
Next question, who is paying for these individual supplies for students? Well, the district will pay for them. We will pay for them with our district money, or we will get donations. And believe it or not, we have a lot of businesses and partners in the community that are very, very generous. And just as in past years, they've donated tons of supplies for students in need in our district. Jennifer?
Ron, this is for you. The HEPA filters are quite, I think people are intrigued. Earlier, Ron said each classroom will be getting a HEPA filter. Is this something, how about offices?
We're anticipating, I think we're ordering somewhere in the neighborhood of 1875 to 1900 HEPA filters. And there's 1800 classrooms. So we'll have some extra HEPA filters. Whether they're HEPA 3 or not, I'm not sure. But how we distribute those extras still remain to be seen. But it sounds like there'll be enough for at least every school to get 1 or 2 extras.
Just a 10-minute warning.
Okay.
Thank you. Did you have something to add, Chad? No?
What is the final word for choir and band? We've heard that PFT, that this won't be allowed. So the latest that I heard is that they're looking into holding choir outdoors. I don't see why. I've seen virtual bands on campus, online during Zoom, but do you have more, Carol?
We talked with a band director today, and they are, that's where I say the expertise is in our teachers. And so we have band directors that are planning to do both in-person and VLA, so they can keep their kids connected and organize activities so that they are safe and the guidelines are followed and securely in place. So kudos to, I believe it's our RB band director that's already out in front of this. So if you're a band director and want to brainstorm, reach out to our band director at RB, because they're Dwayne Otani.
If we are not given our choice of teaching setting, what happens? We're going to try and accommodate you as much as possible to keep you in the teaching setting that you are requesting or accommodated by your principal. But as you know, the district and the site principal has the right to place a teacher in any setting that is within their credential. Is there anything else you want to add, James? Okay. Jennifer, you have another question?
I do. Thank you. If a teacher becomes pregnant and is working in person, is there an option to switch to virtual mid-year?
So at mid-year, as we know, students will also have the option to indicate any change in their learning model. And so we'll have to possibly adjust a certain number of staffing positions based on that need. And with that, if we do have a particular circumstance like this, with a particular teacher who may be out on leave but is able to serve in a virtual learning assignment, we'd have to go on a case-by-case basis to see if the need of both the teacher and the staffing need of the school or the district is a match, to see if we could have a placement of that sort.
Thank you.
Next question. It's stated that teachers with medical conditions could get priority placement within the VLA, PHEP, ND. However, if the ADA meetings have been postponed until the middle or the end of August, when will teachers know their teaching assignment for the year? Don't sites need to know which teachers will be VLA before making other staffing decisions? We really want to know what we will be teaching, and it's not just the day before school starts. James?
So our goal and our expectation is once we have the data of the number of students and the model that they've selected, along with our teacher commitment surveys, our principals would then be able to move quickly to begin planning and confirming their master schedules. And once we have those two pieces of information and then confirm, we can then begin to match the requests that have come in for teachers in this type of situation who've requested a virtual learning assignment based on their credential, to staffing positions at a particular school site in a virtual learning assignment. So we anticipate that once that data is provided and principals are able to work through their master schedules and finalize that, then that process and that information would move quickly, and we would inform all teachers, including teachers who may have an underlying health condition, as this question is asked.
Thank you. I will answer the next question. Regarding access to technology, is it possible to get document cameras to use at the home? The software on my PUSD document camera cannot be updated on my home computer. So the answer would be, we are working on a process to be able to check out your site document cameras in your classroom, and then you would be able to use that in conjunction with the laptop that you would be able to check out. The next question would be for you, Carol. Will ACES be available for middle school students, PUSD teachers?
ACES will be available, and you'll need to be signed up for the ACES program. So it's the same protocols for registering and signing up for ACEs are in place. And it will be open flexibly so that we can provide earlier afternoon care.
We still have a number of questions, so I just want to check with Ms. Peck how much time we have. We're trying to scan through as many as possible because a lot of them are redundant and duplicative. So Christine, how much time do we have left?
This is scheduled to go until 5:30, so we have about 6 minutes remaining.
Okay. If the bus drivers are interviewing and taking temperatures, is there someone to help them? This will take more time. I know that you can add on, but I know that initially when we were doing this for ESY and ESS, initially like the first few days, the temperature taking took a little longer, but then we found that it took seconds after that. But we also are purchasing temperature scanners, especially for our larger schools and stuff, so they'll be able to go by faster. And we have purchased digital thermometers, no-touch thermometers for all of our bus drivers as well too. But initially, everything, as you know, takes a little bit more time, and then as the days go on, it will go faster. And also, there's reduced ridership on the buses, as well as we're asking families to take their temperatures before they get on the bus as well, too. Jennifer?
The next question, can teachers still use Google Classroom in conjunction with Canvas? We're excited to announce a new feature that has come forward with Canvas is the LTI integration of Google Classroom. So as we continue this summer to be able to offer training and support to teachers, this will be something that we will be including in all of our Canvas trainings. Carol, the next question would be for you. May each site be given extra licenses for Lexia to provide intervention for students in grades 2 through 5? Might address it with iReady.
So we've purchased licenses for all of our K-1 students, and sites are able to purchase additional licenses for other grades if they have funds. We also will have iReady. And iReady is a personalized intervention program with a reading diagnostic. So that would be a tool that we have had many of our sites, Los Penn, Pomerado, Midland, who actually prefer iReady. And so I feel that the complement that we have selected will provide great learning opportunities and intervention for our students.
Can I clarify on the mask question that I fielded earlier? I had been asked, would a student be suspended, right, for not wearing a mask if they had a disability? And what I was, in my response, I'd referenced a BIP. And what I want to clarify for our gen ed teachers is in the continuum, the BIP would be the last intervention, that there are many interventions even before that point that we would implement, social stories, behavior interventions, and the like. So, and I also want to remind our gen ed teachers that our current guidelines allow for our students with medical conditions and disabilities, in some cases, not to wear a mask. So I think when it comes to our population, especially as we enter campuses, we need to be patient. Some of our kids are going to need some time to acclimate, and our students with disabilities may need a little more time. And our case managers are experts at managing behavior. So well before a BIP, I'm certain most of the most challenging cases will be resolved, and that will be the last case. So thank you.
Mr. Mizell, this question is for you as well. Is the district providing clear masks for staff to support our DHH learners?
Yeah, at this time, I think you heard we have face shields and we have masks. And we're also looking at, for our DHH, our SL, our speech and language pathologists, our counselors and school psychologists, we're looking at the desk plexiglass partitions. So there's a couple of different ways that we anticipate being able to mitigate the close contact that these particular folks often engage in with students.
Next question. Our new computers at school that were upgraded this summer have no webcam or mic.
So over the past 5 years, we have not necessarily incorporated the webcam and mics in our monitors. Had we had more insight around COVID, we would have definitely looked at including those, but in hindsight, that was a cost savings, and it was not something that all teachers were utilizing, so we did incorporate and make that decision to not add mics and the cameras as a standard because it allowed us to be able to purchase more student devices and more staff devices. And that is part of also the option to have the laptops for checkout, because that will support our distance learning to be able to have laptops taken home and brought back to school.
Next question. May each site be given extra licenses for Lexia to provide intervention for students in grades 2 through 5? Oh, we answered that? Sorry. You're going all out of order, so I'm like going in order. Sorry. Yeah, go ahead.
Skipped. There was a question about MAPS and CASP this year. Because we're using iReady, it allows us to provide access for kids on campus and virtual learning. We are suspending MAP for this year and are taking a hiatus, if you will, from MAP assessments this year. And at this time, the state is telling us that we are scheduled for CASP and LPAC, and so we will be stay tuned for more information from the state, but it is currently scheduled.
So it is 5:30, and we still have a lot of questions. So we can create an FAQ maybe to address some of these questions and provide it to PFT, or Christine, do you have any ideas?
Yeah, so this, as we stated before, this Q&A session was recorded, and so we will be posting this on our reopening website at powausd.com. And then, in addition, we can try to address some of the remaining questions that we didn't get to and include that as well.
But I also think that some of the questions will naturally be answered in the upcoming weeks as the principals start meeting with them and as we start putting out further communications. So some of the more specific questions will probably have to be addressed by your site administrator. So with that said, do you want me to close out?
Yeah, please do.
So I just want to say thank you to everyone up here who took the time to help us with answering these questions. We hope that this was helpful. We tried as hard as we could to answer as many of your questions and concerns. If we didn't get to your question, we apologize, but please know that we're trying everything possible to accommodate you, whether it's medically viable or if it's based on fear. But we are just trying to do the best that we can. So I appreciate your patience and your understanding, and most of all, your support and your professionalism. So we are moving on to do a Q&A with our parents next. So thanks, everybody. And if we can help in any way, please feel free to reach out. Good night.